Good afternoon, everyone, and welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I get to today's numbers, I want to clarify something that seems to be causing some confusion as spring break draws nearer. Under our current public health measures, day camps are not yet permitted to take place. I understand the desire for these camps, and I know that many people would like to have them happen during spring break or the Easter long weekend. But these sorts of activities create risk of mixing groups, and it is extremely difficult to limit the risk of exposure. That is why these camps will not be allowed until step 4 of the path forward. I know this may be inconvenient, but we have seen one case lead to many, and we do not want it to happen in these settings. I also want to advise Albertans that we're making a small change to public reporting for outbreaks. Previously, there was an inconsistent approach to reporting outbreaks in settings that are not in healthcare, childcare, educational, shelter, or correctional facilities. Sometimes these outbreaks were reported publicly at 5 cases, and sometimes at 10. Now we will treat all outbreaks in workplaces and other settings the same, and we will report them when 10 confirmed cases are linked. The thresholds for public reporting of continuing care, acute care, and the other settings that I earlier mentioned will remain the same. Turning to today's update, we have now administered approximately 380,000 doses of vaccine in the province. More than 18,000 appointments have been booked with Alberta Health Services and thousands more with pharmacies since Phase 2A began yesterday morning. Thank you to all eligible Albertans who are signing up to be immunized. Pharmacies continue to book appointments for everyone born in 1956 or earlier. Starting tomorrow morning at 8 o'clock, 3 more birth years will be able to book through AHS. This includes all Albertans born in 1949, 1950, and 1951 or earlier, and First Nations, Métis, and Inuit people born in 1964, 1965, and 1966 or earlier. There is high demand, and some pharmacy sites and phone lines are understandably busy. It's the same with 811 and the online booking tool. We ask for your patience. Everyone will get a chance to book in the coming days. Turning to today's numbers, over the last 24 hours, we identified 355 new cases of COVID-19 and completed about 6,000 tests. Our positivity rate currently stands at about 5.9%. There are currently active alerts or outbreaks in 276 schools, or about 11% of the schools in the province. Currently, these schools have a combined total of 1,160 cases since January 11th. There are currently 260 people in hospital with COVID-19, including 44 in the ICU. Sadly, I must announce that 3 new deaths were reported to Alberta Health in the last 24 hours. My sympathies go to the family and friends of these individuals, and to anyone who is mourning the loss of someone they loved, no matter the cause. In the last 24 hours, we have identified 62 new cases of variants of concern. As I mentioned yesterday, we have now added new variant data to our online dashboard to help keep Albertans informed. Currently, there are 509 active variant cases, which make up about 11% of the active cases in the province. Thanks to the hard work of our labs, we are screening every positive case for variants of concern and now have a surge capacity of screening up to 1,000 samples per day if needed. While we've prevented any significant spread in Alberta so far, the percentage of variants in our active cases is rising. The toll that variants have taken on the UK, Italy, and other countries are a cautionary tale that we must continue to take very seriously. Our aggressive screening, dedicated contact tracing, and other measures have been buying time for the vaccines to work. In some ways, there is a race between the variants and the vaccines. We need to limit the spread of these variants and all other strains of COVID-19 while we work over the next several months to immunize Albertans who are most vulnerable to ending up in hospital and other severe outcomes. While there are still questions and unknowns about how the vaccines will work against all variants, we do know that the Pfizer and AstraZeneca vaccines are effective against the B.1.1.7 variant of concern that is most common in Alberta. The Moderna vaccine functions in an equivalent way to Pfizer, so is also expected to be effective. This is yet another reason why getting immunized against COVID-19 is so important. It will protect you, those close to you, and your entire community. Widespread vaccination will also be fundamental to helping us all get back to a sense of normalcy, closer to what life was like before COVID-19. I know that's something we'd all like to see happen as soon as possible. When it's your turn, please make the choice to be immunized. My team and I will continue to watch our testing data here at home, as well as the latest research and trends around the world, to ensure we're taking appropriate action to prevent the spread of variants in Alberta. In the meantime, we all need to continue to do the things that have worked to keep transmission as low as possible. I know that we are all tired of COVID and tired of the restrictions, but the next few months will be absolutely critical. The health measures in place work against variants. It's just up to us to keep on following them. So once again, I'm reminding all of us to wash or sanitize our hands frequently, maintain physical distance and wear a mask indoors when you are with anyone outside your household. Stay home if you are feeling even slightly under the weather, and keep reducing the number of in-person interactions that you have. These simple steps continue to be our best bet at keeping COVID-19 under control and allowing us to hang on for a few more months while we roll out the vaccine to all in Alberta. Thank you, and I'd be happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First question is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. You provided more detail yesterday about Phase 2C, but some occupations were not included, particularly firefighters, grocery store workers, transit workers, and teachers. You said in the past that the province has to make difficult decisions and protect the most vulnerable, and you've also said there's a limited supply of vaccine. So what factors and local data were weighed for deciding which occupations were and were not included on the list?
When we made the difficult decisions, as you say, in the face of limited vaccine supply, we were focused on those individuals and groups who are at the highest risk of severe outcomes, and those places where we have seen explosive outbreaks transition from one case to many very, very quickly. And in the context of those parameters, again, wanting to make sure that we were putting measures in place to prevent significant large outbreaks as well as transmission to those who are at the highest risk of severe outcomes, we were looking at the people who support those different populations. So, for example, we know that individuals who have chronic health conditions, as the list outlines that we announced yesterday, those individuals have a higher risk of severe outcomes, and individuals with those kinds of health conditions are often cared for by healthcare workers in a variety of settings. And so again, healthcare workers who provide that direct patient care are offered vaccine because it's critical that we're providing that protection to those who are at high risk. In addition, when we look at settings like correctional facilities, shelters for those experiencing homelessness, group homes, and locations where we have seen in the past that spread from one to many very quickly, we also are offering vaccine to those occupations who work closely with individuals in those groups. We know that there are other occupations, such as the ones you mentioned, that will benefit from the vaccine, and all Albertans will have an opportunity to receive vaccine within the coming months. But what we're doing in Phase 2 is we're working to prevent those highest risk outcomes, and we're also working to make sure that we're minimizing the chance of explosive outbreaks with very, very significant spread in a short period of time. We know that anyone who's in those occupational groups who is individually at high risk because of their age or their chronic condition will be eligible to be immunized in the coming weeks. And we know, again, that those individuals who are not in Phase 2 will have that opportunity to receive vaccine within the coming months as Phase 3 opens up.
Is there a follow-up, Julia?
Yes. As you continue to get different feedback on phase 2C in particular, do you expect that there could be changes made to who does and does not qualify, or do you see these as being quite set in stone?
It's really important to remember that the phases are about allocating a limited supply of vaccine. So if there are individuals or groups who are added, then essentially those groups would be displacing others who are at high risk. And it's important to remember individuals between the ages of 50 and 64 are in phase 2D, and those individuals still have a higher risk than younger individuals for having severe outcomes such as hospitalization. So again, it's really critical when we're thinking about the groups who we're offering vaccine to, that this isn't about the value that people provide to society. This isn't about how we're assessing different groups and the work that they do. All of these different groups provide critical and essential services to society. What we're doing is we're looking at risks of widespread outbreaks, risk of hospitalization and death, and we're focused on preventing those most severe outcomes. And then we'll be moving to that broad population prevention of spread across the whole population.
Operator, could you put through the next caller, please?
Next is Carly Robinson with City News Edmonton. Go ahead, Carly.
Hi, Dr. Hinshaw. Just to follow up on Julia's question there with looking at other professions like transit operators, peace officers, firefighters, is there any plan when we're looking towards 2D or even into phase 3 with the general population to still do some profession specific when you're talking about professions that do interact a lot more with the public than others?
Those kinds of decisions about phase 3 have not yet been made. Again, what's really important to know is that with our current approach to immunization, every single person in Alberta will be able to receive their first dose if our vaccine supply arrives, as we expect it to, before the end of June. And so again, when we're looking at that phase 2 unfolding in the next couple of months, phase 3 and how that rolls out will yet be determined, but every single person in Alberta will have that chance. And transit operators, teachers, firefighters who are at an individual high risk of a severe outcome can access the vaccine as soon as that particular eligible criteria comes in terms of 2B, or if they're eligible by age in either 2A or 2D. So again, for individuals who are at high risk, no matter what their occupation is, they will have the chance to be protected. And for some of those others, again, phase 3 decisions have not yet been made.
Is there a follow-up, Carly?
Yes, I'm just wondering if beyond the medical impact has been looked at, because Edmonton's firefighter union is saying the amount of times that they've had members self-isolating is so high, they fear in the future they might not be able to respond to all calls on the front line because they have such high numbers of members self-isolating. So was that a factor that was looked at in deciding this eligibility?
When we focused on our phase 2 criteria, again, we were really focused on preventing the severe outcomes and preventing widespread transmission of COVID-19. It's again important to remember that any groups that we add to earlier phases displace other groups. So we only have a limited amount of vaccine, and we had to make choices about what kinds of outcomes we were going for. I recognize that there are impacts to other groups, such as the ones that you mentioned, and we are working with different groups as we're rolling out our rapid testing program to consider how we can potentially reduce impacts of COVID-19 in other ways. But for the vaccine, again, our priority was preventing hospitalizations, preventing deaths, and preventing large outbreaks that spread the virus from one person to many over the course of just several days or weeks.
Operator, could you put through the next caller, please?
Next is Lauren Krugel with the Canadian Press. Go ahead, Lauren.
Hi there. Thank you for taking my question. Just wondering if there was any update on how successful we've been at getting 6 doses instead of 5 doses out of those Pfizer vials.
We, since we've received the shipments of the low dead space volume syringes, which are the specific syringes that minimize the wastage. We have been successful at getting that 6th dose almost 100% of the time, which is great news. And those low dead space syringes are a critical part of that approach, which allows us to move from the approximately 75% where we were using a variety of different syringes to, again, almost 100% in our current practice.
Is there a follow-up, Lauren?
Just a quick one. How was the supply of those dead space volume syringes? Do we have enough of those?
I'll have to get back to you about the specific numbers. I haven't heard any concerns about a shortage, but we can see what our latest numbers are and provide that to you.
Operator, could you put through the next caller, please?
Next is Julie Belgic. Sorry about that, with CVC. Go ahead, Julie.
Hi, Dr. Hinshaw. People 75 and older have been eligible to get the vaccine for several weeks now. What percentage of the population that are eligible to get the vaccine have done so, and is that number on the right track for herd immunity?
I don't have the breakdown of the specific age groups with respect to how many of each of those age groups has received the vaccine. I know that we were seeing a very high uptake in continuing care facilities in the 80 to 90% range of residents of those facilities, but I don't have that current statistic for those 75 plus, so that's something we'll have to follow up with offline. We have seen a high uptake and high interest. And we are seeing in our polling data that across different age groups, approximately 80% of Albertans are reporting that they are interested in being immunized when their turn comes, which is great news, and those numbers will help us protect our communities.
Julie, do you have a follow-up?
Yeah, with the underlying health conditions for 2B, why did you choose to include pregnancy? And is there a stage in pregnancy that's recommended to get the vaccine? Or would women trying to get pregnant be included on that list?
So pregnancy is a condition that a multitude of research has indicated causes an increased risk of severe outcomes over when compared with women who aren't pregnant. And when we were looking at the different conditions that could potentially be included for eligibility, there was a decision to include that. We know that women will have to assess their own personal values, the risks of those severe outcomes, against the fact that there have not been clinical trials that have been done in women who are pregnant. We know that observational data indicates that in the clinical trials and in real-world effectiveness observational outcomes, there has been no adverse events that have been reported either for pregnant women or for their babies. We know that both pregnant women and their babies are at increased risk of severe outcomes when it comes to being infected with COVID-19. And so again, we wanted to give women that opportunity to make the choice for themselves based on that balance of risks, understanding that there is still some evidence that's not available, but we know that the Canadian Society of Obstetricians and Gynecologists has recommended that pregnant women be offered the vaccine. There is no specific stage of pregnancy that would make a woman eligible or ineligible. So at the moment, if a woman is pregnant, she would be eligible within stage 2B and can make that decision again based on conversations with her care provider and considering all of those different factors.
All right, we've got time for 2 more callers. Operator, could you put through the next one, please?
Next is Matt Woodman with CTV Edmonton. Go ahead, Matt.
What your message is for bars and patrons who are possibly going to be going out and celebrating tomorrow. I know St. Patrick's Day people can obviously overindulge and possibly break the rules without really thinking about it.
I think that with the spring weather upon us and nice weather, I would say that there's the opportunity to consider outdoors. I know that many locations, many restaurants and bars have been looking at opening patios. So it's always critical to think about when you're wanting to go out and celebrate an occasion like this, to do it in a way that doesn't put other people at risk, considering what kinds of events can happen outdoors in a way that, again, doesn't risk that transmission. And remembering that even though people, again, are tired of COVID-19 restrictions, these next few months are critical. And so when making your plans for tomorrow, think about how you would want the people in your life you care about who maybe have a chronic illness, who are older, how would you want them protected, and take those same actions that you would want others to take to protect your loved ones who have that high risk.
Is there a follow-up, Matt?
No, I'm good, thank you.
Operator, could you put through our final caller, please?
Final is Dylan Short with Post Media. Go ahead, Dylan.
Hi, Dr. Hinshaw. Yesterday you announced that when 2B comes around, that there won't be a need for doctor's notes, that it'll be an honor system. Since that announcement, I've received a few people, or notes from a few people that are worried about queue jumpers. I know that we haven't really seen that here in Alberta, but it has happened in other parts of the world. So I was curious, what steps are in place if someone's found to be jumping the queue?
So if somebody is trying to obtain the vaccine when they don't actually have one of the chronic conditions that put them at risk, first of all, I would say to that person to consider that you, by taking vaccine that you're not eligible for, are putting somebody else at risk, taking somebody else's place in line. We know that when an individual goes to get their vaccine, they will be asked if they have a chronic condition. So again, they will be directly required to make that statement. So that's again an opportunity for them to consider whether or not they actually meet those criteria. If somebody's not sure, there is an opportunity for them to talk to their healthcare provider to determine whether or not they have a condition that in fact does put them at risk. And then there are certainly opportunities when the person's going to their own pharmacist or their own physician who obviously would know their health history. If they are claiming to have a condition that they actually don't have, then that would obviously come up in that location. So ultimately, again, what we're doing is showing that we are relying on Albertans to make sure that they're stepping up when they're eligible and not before that, because again, that just puts others at risk if you take someone else's spot in the line.
Is there a follow-up, Dylan?
Yeah, I was just hoping you could expand on why the decision was made to include 3 birth years in tomorrow. Is that because of increased capacity in terms of booking or more vaccine arriving, or just expanding on why that decision was made?
As Alberta Health Services has been working to make sure that its booking tool is as robust as possible, they have been trialing and testing, and they are confident that expanding to 3 additional birth cohorts can be managed by the system, as they've been watching over the past couple of days with the expanded cohorts that have come in. And we know again that there's many Albertans who can benefit from the vaccine. So we're wanting to provide that opportunity for people to book as quickly as possible, and the system, again, has been made robust so that it can handle this additional 3-year cohort all at once.
Thank you all for joining us today. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.